Fortunately, the narrative in the legislation is clear on what constitutes grandfather status. So an individual, a plan in which an individual is enrolled, existing plan that was in operation on the date of the enactment on March 23rd. So that's nice and clean and cut and dried. That's probably the only thing you're going to see that's very clean and concise. There's a lot of speculation about what could cause a plan to lose its grandfather status. That narrative is yet to be written. What if you're an employer whose plan renewal was the 1st of this month, April 1st, and you made changes to your plan? Maybe you changed your provider of coverage. Once the narrative is issued in terms of what might cause you to lose your grandfather status, you could have a retroactive loss of status. Unfortunately, we just don't know, because the clarity hasn't been issued to identify what things will trigger a loss of grandfather status. So as we talk about some of these provisions, just keep that in the back of your mind. We just don't know yet. Hopefully, there's an appreciation at the legislative level that this is an item that needs relative quick clarification. What I want to talk about, rather than what you see in your packet in terms of those provisions that are listed that grandfather plans are exempt from, I want to talk a little bit about the provisions that grandfather plans are not exempt from, because that's where you have to go and do a lot of searching, because no one's really issued that laundry list. And I won't say that laundry list is necessarily all-inclusive that I'm going to talk about this morning, but I think it hits the primary points of what we can find in the legislation so far. So there are half a dozen or so provisions that excuse me. So you're exempt from all market reforms with the exception of those that are listed in your packet. So what doesn't apply to grandfather plans? The requirement to provide coverage, first dollar coverage for preventive care. Now, the reality is a lot of plans today already include first dollar coverage for preventive care, and there are very good risk exposure reasons why you want to continue to have that to help manage the health of your population. So as an employer, I wouldn't take this as a signal to unwind whatever preventive care provisions you already have in your plan. You want to keep those going forward, but the law says that you don't necessarily have to comply with that if you're a grandfathered plan. There are limits on pre-authorization requirements. There's a provision regarding the selection of any primary provider that you would not have to comply with. There are new non-discrimination rules for fully insured plans. How many of you have self-funded or partially self-funded plans? So you've been operating in a landscape where you're accustomed to non-discrimination rules under ERISA. Now fully insured plans will have non-discrimination rules apply. There'll be a new appeals process, and a lot of people say, well, that's not a big deal. We already have claims appeals language in our provisions. Our health care plan provides that for us if we're fully insured. There are some significant differences in the language in terms of now what constitutes an appeal process. So everyone's plan language will have to change relative to appeals process once and if you lose your grandfather status. There are specific limits on out-of-pocket expenses and cost sharing that come into play, and grandfather plans would be exempt from that. And the guarantee issue and renewal provision would also have that exemption. A lot of these provisions, stepping away from grandfather plans for just a moment, are going to require action on your part as employer. Again and again and again over the course of time as these provisions run through the timeline. So some of the things you want to be thinking about are evaluating your program, an overall comprehensive review of all your benefits programs keeping the various provisions of the legislation in mind as you go through that evaluation. You're going to need to update internal procedures. You're going to need to communicate with your employees and potentially dependents on what's coming, how it impacts them, what their rights are. There are certain triggers under the legislation where you have mandatory obligations to notify your employees of certain provisions. And then the updating of plan documents, summary plan descriptions, all of those things are going to come into play. There's been a lot of speculation about the initial consumer-friendly provisions, such as no pre-existing on children, the removal of lifetime limits, and how those are going to impact pricing. And how many of you think that will make cost initially go up? 100% of hands, right? 100%. Anytime you're enhancing the coverage provisions of your plan, you're allowing an additional group of dependents to come on the plan. Now, in theory, actuarially, those are young, healthy people. That should have a positive impact. But you're removing the ability to apply pre-existing. While it is limited in today's group insurance environment, it does exist, that ability to apply pre-existing. Removing lifetime limits. What I'm hearing are speculations that these initial consumer-friendly provisions will likely increase plan premiums or plan costs 2 to 4%. So, unfortunately, we find ourselves in a situation where what starts the dialogue over and over again relative to healthcare reform doesn't appear to be addressed, which is cost. And cost is what impedes access. So, unfortunately, we're going to be in a situation where our health plan costs initially are going to go up.